Well, my name's Stephen Firn. I'm one of the recently appointed non-executive directors at Look Ahead. Well, I think the main opportunity for Look Ahead is linked to this almost unique offer that they provide around, or we provide around being able to offer stable, good quality accommodation for people at incredibly vulnerable times in their lives, alongside that excellent care and support. And having spent most of my career in the NHS, that's something the NHS can't do. I mean, the NHS is good at treating people in a crisis and helping people get back on their feet. But for people with the type of vulnerabilities and needs that Look Ahead provides support for, they're often, once that bit of treatment's over, they're left to go back to a life where they don't have good accommodation, where they don't have a circle of support, where they don't have often meaningful occupation and things to do during the day. And of course, inevitably, that means they're more likely to experience relapses and less likely to fully recover and fulfill their potential. So the opportunity for Look Ahead is really to enhance that offer of support to people that isn't available elsewhere, and really make a huge difference to people's lives. And I know the recent research that Look Ahead have launched, that really highlighted how this is such a gap in the system, and a huge opportunity for Look Ahead. If we can convince the commissioners and the local authorities that actually this is the way that services should be delivered. And this year, 2001, it'll be 40 years since I joined the NHS. And I initially joined as a callow youth, as a summer job, as a healthcare assistant in an old institution, what was essentially an old asylum, people with long-term mental health problems. And I thought I'd only stay a few weeks, particularly as I saw some really dreadful and shocking treatments and things at the beginning, which really sort of shook me to my core. But I also saw some incredible acts of compassion, particularly from a couple of the nurses that I worked with, and that inspired me to actually train as a mental health nurse, which I subsequently did. And that's been my life and my passion really for the last 40 years, working with people with mental health and learning disabilities. I was lucky enough to be on a trust board for 20 years as chief executive of Oxleas in southeast London, so mental health, learning disabilities and community services, and thoroughly loved that. And when I retired 4 years ago, I wanted to still contribute, and so I now have a few part-time roles as a non-executive director, one of which is with Look Ahead.